Hepatitis C is an infection that affects primarily the liver, but it's a bloodborne infection. Some people have no symptoms whatsoever. Some people can get really sick. They can get jaundice, which means yellowing of the skin because their liver is not working. Some people won't have any symptoms until 10, 20, 30 years later. And some people, unfortunately, will die from hepatitis C infection. The majority of people that we see with Hep C are people who have used IV drugs. But there's other people who are at risk, people, baby boomers primarily, who have been come into contact with blood or procedures from a long time ago before we were able to properly screen and clear for Hep C. Getting a tattoo in an unlicensed parlor where you have needles that might be reused. The other way that people might get Hep C is through sex. If you have multiple partners or if you've been recently diagnosed with an STI, those are other risk factors, and you should definitely get tested more often. About 75% of people with Hep C don't even know they have the infection, which is why we encourage everybody to get tested.
One of the amazing parts about hepatitis C is that it is curable. We can get rid of it completely. Trillium is a one-stop shop. You can come in, you can get tested for Hep C. If you are positive, we have your pharmacy right on site. You will hopefully get on treatment the same day. 1 pill a day for 12 weeks or 3 pills a day for 8 weeks. Treatment is very simple, it's very short. There's not a lot of drug interactions and very, very minimal side effects. We're accepting referrals from anywhere, providers, drug treatment facilities, jails. We accept all new patients. We will help you get through the treatment process. We try to make it as easy as possible for you. So if you do not have insurance, we do have insurance navigators on site who can help you apply to insurance. If you're unable to get insurance for whatever reason, your financial situation will not be a barrier to you getting hepatitis C treatment from Trillium Health. One of the things I love about working with our patients is that a lot of them maybe have experienced stigma in healthcare in the past. I really try to provide them with a safe environment. I want them to feel comfortable getting treated for Hep C, and I love working with them. I love seeing people's faces when they find out they're cured of Hep C.
We have a judgment-free zone here. It doesn't matter how you got infected. We will do everything we can to make sure you get tested, you get treated, and you get cured. And that's how we're going to end the Hep C epidemic.